What if there was a nutritional support for your body that could help with a lot of different disease states, that could help support your body with blood pressure, digestive health, support better blood sugar balance, possibly help with osteoporosis, muscles, and more? It turns out there is actually a very simple, often overlooked nutritional support. It's called nitric oxide. And I am so delighted today to be talking with Dr. Jay Wilkins. And I'm going to tell you just a little bit about him, and then we're going to dive in and learn a little bit about the science behind nitric oxide and why it's something really important to include into our everyday nutritional routine. So Jay Wilkins is a naturopath. He's been in the health and wellness industry for more than 25 years. He operated a fully staffed wellness center from 1993 to 2005 and focused on a whole bunch of functional medicine, energy medicine, detox programs, and more. And then in 2005, he learned about a Nobel Prize winning research on nitric oxide, which, believe it or not, is all the way from 1998. A long time ago, we've heard about it, but somehow that information has not really carried forward. So we're going to talk about that too. Anyhow, as a result, Dr. J wound up shouting from the rooftops about the benefits of nitric oxide and began teaching something called pulse wave analysis, which is a non-invasive vascular screening technique that indicates arterial constriction, stiffness, blockage, that kind of thing. And then seeing how nitric oxide can actually cause those things to reverse. Since 2012, he has served as the chief medical advisor for a number of GMP supplement manufacturers, assisting clients in creating safe and effective supplement formulas. Then in 2013, he created his flagship nitric oxide nutraceutical, and the company is called Bionox. We'll talk about them, but he has been pioneering products that help activate your body's inner power to help you realize optimum health. Dr. J, thank you so much for being here.
Thanks, Mira. Appreciate it. It's great to be here and talk about something that is near and dear to my heart.
You know, and I think one of the things that's so astonishing is we've known about nitric oxide for a very long time, but somehow it seems like the forgotten stepchild of the nutrition world. Can you tell us a little bit about how it was discovered and what some of these great benefits are?
Sure, yeah. As you mentioned, 1992 is when nitric oxide won Molecule of the Year. And then from there, as you mentioned, 1998, Nobel Prize winning research, all supporting your body's own natural abilities and natural precursors to be able to produce it. So that's big, right? It doesn't get any bigger than Nobel Prize winning research. So that caught my attention in 2005. I was embarrassed I hadn't even heard about it for 7 years. And to your point, this molecule, one part nitrogen, one part oxygen, over 100,000 research articles, most studied molecule in history. And you got all your different pharmaceutical companies trying to harness this molecule and produce it in a synthetic way. So it is such a compelling story. And I was just blown away when I first learned about it, then started implementing it into my practice, and the results that we were getting were phenomenal. And so that's when, basically, as you read my bio, I closed the shop on the naturopathic practice and got fully engaged in this whole nitric oxide story.
Yeah, and I think one of the things that's important for people to understand is, because it's so supportive for so many different areas of the body, chances are we could be a little depleted, even if we're consuming foods that are a good source of nitric oxide. Depending on what your bio-individual body needs, you may actually have a higher need for it. Can we talk about some of those? Because I'm all about ingredients and food.
Sure.
Can we talk about some of the foods that are a really great choice for nitric oxide?
Absolutely. So when I first got involved, the main research was on amino acids, primarily arginine and citrulline. And so those, of course, are in all your protein sources. But then, as Dr. Ignaro noted, one of the Nobel Prize winners, he said that we just can't consume enough of arginine through foods alone. It's really, supplementation is critical, and that he felt that's something that we should do every day. And again, when we hit 40, we have about 50% of the nitric oxide we did when we were in our 20s.
Oh, wow.
So it does deplete. So one of the primary things that nitric oxide does, it's a vasodilator. It relaxes blood vessels. So as you mentioned, blood pressure issues. I've not seen anything natural or synthetic that can have such a profound effect on blood pressure. And then all the research really highlights that over time, you can actually reverse plaquing. You can anything to deal with cardiovascular issues. And again, we're not talking about something that you take. You don't take nitric oxide. You can as a gas. They actually administer that for COVID patients as a gas to be able to relax the lungs, to help with infection, to be able to help with inflammation. But it's what your body makes that we're talking about. So we're just talking about eating things, consuming things, doing things that increase this gas in your body. So yeah, cardiovascular, diabetic issues, insulin resistivity, all the complications dealing with diabetics, urinogenital type issues, prostatitis, cystitis, as well.
Wow.
I mentioned osteoporosis. I actually had some bone loss because I was taking some prednisone for a period of time. And so a doctor had a scan done and it showed that I was starting to have some bone loss, and started doing vitamin D and arginine as a precursor for nitric oxide, and had it rescanned, and all of it had rebuilt. Yeah, so it's called the miracle molecule for a reason. It just does so many amazing things in your body, and it's critical for health. So to your point, how is it that this isn't top of mind for us? Sometimes it's just strange. It just gets buried. We get distracted, or I don't know what happens, but I'm here to change that. That's my goal, is to make sure that I keep this nitric oxide story alive.
That's cool. So I have a question for you, because I know there are certain foods that are tied to being able to help increase nitric oxide in the body. Things like beets and dark chocolate and dark leafy green, even things like pomegranate and that sort of thing. So when we add those to the diet, you mentioned that after 40, our levels drop. So even if we're increasing those in the diet, the body's still having a depletion.
So I'm glad you brought me back around to that point. The amino acid arginine and citrulline you get from your protein sources, it seems like supplementation is critical now. That is through the arginine pathway. But there's another pathway, and the other pathway is called the nitrate pathway. And nitrates are in foods, as you mentioned, arugula, spinach, greens. It's in beets. That's why beets are being touted now as this wonderful superfood, and it really is. And so these nitrates, as you consume them, they convert by your microbiome in your mouth into nitrites. You swallow those nitrites and it hits your stomach acid and produces nitric oxide. So it's a same molecule, but a completely different pathway than how arginine is producing nitric oxide, which is good because either of those pathways can be compromised. So if you boost both of those, then you have a really good chance to help to restore nitric oxide in your body.
And I think it's really important to point out that those are naturally occurring sources of nitrates and nitrites. When we are purchasing things like processed meats or other things that have the chemical analogs, your body can't use those. And as a matter of fact, those can have a toxic impact on the body.
Yes, so that's in your wheelhouse. I know you're big on ingredients and food ingredients and making sure that we're taking things that are safe into our bodies. And to your point, so these I'll call synthetic forms of nitrates that are used in cured meats, actually biologically, they are the same in the body as naturally occurring. The problem is that when those are consumed with meats, then those nitrates combined with the meat, you create nitrosamines. So that is a toxic substance, chemical, free radical that has been associated with things like stomach cancer and colon cancers and those type of things. But we know beets are good. We know spinach is good. We know those things are awesome for our bodies, and we're not going to stop eating those, but it has nitrates in it. So yeah, we don't want to get confused. As much of the naturally occurring nitrates that we can get into our body. In fact, a very popular diet for helping with cardiovascular issues is called the DASH diet, dietary approaches to stop hypertension. And if you follow that program, you could be eating as much as 1,500 milligrams of nitrates per day with all those greens and the beets and all those naturally occurring nitrates. And it's very supportive for cardiovascular health.
That's great. So I'd like to circle back just a little bit. You were talking about blood pressure and arterial plaque and how those things can be reversed. So if someone were, for example, hypertensive and they started changing their diet, supplementing with the arginine and that sort of thing, you can actually reverse that. Is that what you're saying?
Absolutely. And that's been, again, documented very well. There were some really nice studies that were done by Dr. Cook, the head of cardiovascular research at Stanford, as well as Dr. Ignaro. In two separate studies, they showed when rabbits were given a high cholesterol diet, they all developed plaquing. When they then supplemented after giving them a high cholesterol diet with just a regular rabbit diet, they kept their plaque. But when they gave them arginine, citrulline, and and antioxidants, then they got the greatest results of plaque reduction. And we've seen the same thing. I've seen ones that have used these nitric oxide precursors and they had carotid artery congestion or coronary artery issues. They would take these things, they would get their body producing nitric oxide again. In fact, Dr. John Cook, his book is called The Cardiovascular Cure. And the cardiovascular cure is nitric oxide. It's your body's best medicine. Absolutely. We're not stuck with our plaque. We can reverse it. All the big names in our arena, like Dr. Steven Sinatra, integrative cardiologist, recommends nitric oxide precursors. Of course, Dr. Oz, Dr. Mercola, all the biggies, they see the value of it.
And so how much nitric oxide should people look to add on a daily basis? And is this something that changes over your life cycle as your body need modifies?
Yeah, so we've had individuals that were in very chronic conditions, a lot of times older individuals. We've had them take as much as 20,000 milligrams.
Oh, wow.
Yeah, so 5,000 milligrams of arginine is a minimum therapeutic dose. That's one that really seems to have the most research on it. 2,000 milligrams of the citrulline. So those work really well in harmony together. Call arginine the Batman and the citrulline the Robin. They just are very synergistic. They help for a turbocharging of the nitric oxides, the time release effect when they're taken together in those ratios. And then also the antioxidants, vitamin C, E, D, pomegranate, as you mentioned, camoberry, grape seed, grape skin extract. Those all help to sustain nitric oxide, help to keep it from antioxidant or free radicals from breaking it down. And then as far as nitrates are concerned, at least 300 milligrams if you're really working on like blood pressure issues. Now you can take less just for health maintenance, but to really address chronic issues, 300 milligrams of a bolus effect or all at one time is what you're looking for. And then maybe 12 hours later doing the same amount. But as I mentioned, the DASH diet, you could be getting as much as 1,500 milligrams a day, and it's safe and effective.
And I think one of the things that I really appreciate is that all of these things, all of these bio-individual body states, whether you're hypotensive, osteoporotic, or you have some sort of uro health issue, those are all trackable so that when you make changes to the diet, getting rid of artificial ingredients and adding real whole foods to the diet, supplementing where necessary with different things, you can really, it takes the body a while to change, but you can see changes, which I think is really powerful.
Yeah, that was my whole thing back when I first learned about it. The research was compelling, and then to see what it did with my patient base was so compelling. And so these are supplements that really work. So that's what I was so encouraged by, and the amount of reviews and the stories and the feedback we get from our practitioners that are recommending these supplements to their patient base, from us individually. It's really encouraging to see over the years the kind of results that people are getting.
That's really amazing. So if someone wanted to connect with you, connect with your clinic, where would they find you?
As far as the supplements that we're recommending, and you want to go learn more about those, bionoxusa.com is our website. If you go to Bionox, search it on YouTube, we got a lot of really great
Great.
interviews. In fact, one interview that we did with you a while back. So we got other practitioners that we've interviewed. So that's a great way to get in touch. I don't see a lot of people anymore. We just, my wife and I will see a handful of folks. That's really all I have time for anymore. But they can reach out to me personally at Dr. J, DRJAY at bionoxusa.com as well.
That sounds great. And I'll make sure to put that information down below.
Okay.
Thank you so much for coming on today. We've learned so much about this amazing, amazing molecules and the nutritional support that it engenders for the body. I'm really hoping that it will not take 20 more years for people to really realize that they need to be having more nitric oxide, more arginine, more citrulline in their daily routine, their daily nutritional plan.
Sounds like a plan. And we're actually got some things that are brewing now that are coming to fruition that I envisioned back in 2005 when I first learned about it. So there's some exciting things that we have going on right now that will really support our message, and we're super excited about it. So keep posted. In about 90 days or so, we should have some nice results back, and we're super excited.
Keep me posted. I'm definitely happy to share and put that down in the description below as well.
Yeah, absolutely.
Dr. J, thank you so much for your time and for talking with us. It was really wonderful to chat with you.
Thanks, Mira. It's great to get back together again.
Yeah, absolutely. Okay, folks, thanks for joining us. Don't forget to click like, subscribe down below. Stay tuned, stay connected so that you can share and learn in more of these amazing things and the wonderful visitors that we have. Take care now. Bye-bye.